Hey guys, this is Dr. Sean over at Fortis, and this is for the Anatomy and Physiology class. Today we're in week 5, and I'm doing the assignment. I'm going to go through a couple of parts of it with you here, just to make it kind of easier. We're looking over here at this page. This is the 9 out of 10 of the assignment parts. They're not terribly hard, but they can flub you up, and I'll show you why. So I'm going to go through this list right through here. I wish I could set things over so I could see from the other side. Let's see if I can do that. There we go, because I'm looking right at it. See? How's that? Kind of cool. Let's move our phone out of the way. There we go, and you can see the other side of the office. Right there's the clock, so you can tell what time it is, and right over here, that's... Where is it at? Right there. That's the Adjust a Monkey I use. There's all my supplements that I offer to patients, a couple different companies, and those are my files right there. And then that's, you see there's the dog that's back there? No. Anyway, so let's go through these here. We have the digestive system. The digestive system has a bunch of different parts. In this one here, we only have 8 pieces. Nine pieces in this. And if we go from the top, I'm going to go over here, and hopefully you can see my... There we go. Number 1, that's going to be the tube that goes from the mouth, right, all the way down to your stomach, right? It has a sphincter at the top, right here. This one, which is voluntary in most people. And then you have the tongue, right? And then you have some other pieces back there that keep food out of the respiratory system, like the uvula, that thing, that little punching bag back there. That actually folds up and keeps food from going up into the sinuses, the nasopharynx, which is in another one we'll go over. The second part is as we come back and the food pushes down, it'll go past the thing called the epiglottis, which will close off the trachea so the air again doesn't go into the lungs. So as that peristaltic action of this guy pushes food, which is called a bolus by the time you've eaten it, you've chewed it up, you've added saliva, which has amylase and stuff like that, and then you swallow it down. That's called deglutition, mastication, deglutition. As it pushes down, it goes through this cardiac sphincter, which is right underneath the diaphragm. Right, diaphragm is everything in the abdomen and below, right, and the diaphragm up is going to be the lungs, which we'll do in a minute. As it goes down, number 2 and number 3, number 2 is just esophagus. That's all it's going to be, or maybe oral pharynx or something. Number 3 is the esophagus. Number 4, that's the stomach. That's where you make like some of your gastric juices. It has things like rugae, and the stomach actually churns and it moves things around once it's mixed with some gastric juices and water and stuff to kind of like dissolve it. We've chewed it up in here, broken it down, right? Swallowed it down, gets down there, starts to move it around. Warms it up too so it can be absorbed. As we go down to number 5 is actually the gallbladder, the vesicula in Spanish, and it's a little guy, usually shown in green for some reason. I don't know why. But it's attached from the liver. The liver makes bile, and bile is made out of old blood cells, hemoglobin. It's turned into bilirubin and biliverdin, and that's mixed with cholesterol and some other stuff to make bile. Bile is basically soap. So you know when you're cleaning dishes and you have that big bunch of spaghetti sauce, right? It makes that oil slick on the top. You put 1 drop of oil in there, woo, it all goes out like that. That's what it does. That's what bile does to fats. So number 5, number 6, where's number 6? Number 6 is the small intestine. It has 3 different parts, which we will see in here. I'm going to go through those with you real quick. 3 parts are going to be the duodenum, first part, jejunum, and the ileum, those 3 parts. Ileum is called because it's always been seen as empty, basically, when they did dissections. I don't know if that's actually true in regular people, but it does make some grumbly sounds when your parasympathetics are going and you're feeling nice and relaxed and things like that. When you listen through auscultation using a stethoscope on the stomach, you should always hear sounds. It's not going to be constant, blah, 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 but it'll be like little weird sounds like that. That is normal. That's what we want to hear, right? That's air moving and things moving through the gut because there's peristalsis, that little movement of getting stuff through that pipe, right? Number 6. Number 7 is the large intestine. Large intestine also has a bunch of parts. It has the cecum, which is the very first part of the large intestine. And there's another sphincter right in here, which is called the ileocecal valve. And that one can stay open and stuff gets back and forth and we feel cruddy with that one. There's different kinds of treatments to manipulate that actually by hand. Attached to that, which it doesn't show here, is a little tiny guy, which is called a vermiform appendix. The appendix, of course, is your appendix, right? People get it removed because it gets infected. Actually, it's it always has bacteria in it. It's actually kind of like a little tube of toothpaste that has bacteria, like in case your bacterial group down in through here, which is beneficial to you, is called a microbiome, gets out of balance. It can squirt a little bit of that out there, and it replenishes it and helps it grow properly. The second part is the ascending colon, goes up on the right side, then it goes across. So there's a hepatic flexure on the liver side, hepa, liver, right? Goes across, which is transverse, and then goes down, makes a little turn at the spleen side, left side, splenic flexure. Flexure means bend. Right? And then it goes down, descending colon, and then goes to the sigmoid colon, which is a little S-shaped thing, sigmoid, then to the rectum, and then out through the next set of two sphincters, which is the internal and external anal sphincter. Right? There we go. So that's 7. Where's number 8? 8 here is this little fluffy thing through there. Now, in a lot of places, it used to be considered fat because it looks like fat. It's a gland, super important gland. It is exogenous, puts stuff out into this system. Right? And it's also endogenous, which means it puts stuff into the, or endocrine, exocrine and endocrine, right? It'll put stuff out into the bloodstream, which is endocrine, or out into the tube, which is exocrine. So the exocrine version is the amylase and proteases and lipases and stuff like that, little things that help you digest foods. And the inside one that goes to the blood is the insulin and glucagon. So there we go. There's a quick overview. I already filled these out so you can follow along with me, right? Pretty easy. Using the image above, place the corresponding number next to the text. Correct description, not all the numbers will be used. The organ that produces bile and secretes into the hepatic bile ducts. Creates bile, produces bile is the liver. Okay. Chief organ of detoxification, that's the hint. The walls of this structure secrete cholecystokinin. Most digestion and absorption occurs within this structure. The inner lining of the structure is characterized by villi, little tiny fingers, and little microvilli, very, very small fingers, and brush border cells. These are cells that absorb whatever is next to it, right? They'll say, I want to absorb proteins, and I want to absorb amino acids, or whatever it is. That's going to be the small intestine. The pylorus connects to the stomach within the structure. The pylorus, there's those 3 parts I was talking about, duodenum, or duodenum, jejunum, and ileum. Paralysis, a pendulum sways back and forth in this organ. It kind of squeezes like this. Like it's like if you had a bit long tube and you were squeezing stuff through it. Like when you make cookies and you're making the icing for the cookie, you squeeze the thing, squeeze from one end, right? That's what it does. This foot tube that carries food from the pharynx, food tube. That's the esophagus. Goes all the way down. Remember we talked about that behind the esophagus, or behind the trachea, Pear-shaped sac that attaches to the underside of the liver, concentrates and stores bile. Stores bile. Bile is a digestive thing for fats. That's the gallbladder, vesicula. Parietal cells of this organ secrete hydrochloric acid. Hydrochloric acid is your first thing, an intrinsic factor. Folds called rugae. These are the inside. So in the roof of the mouth, if you rub your finger in there, you feel these little ridges. Those are also called rugae, right? Those are things you see on the top of a cat's mouth or a dog's mouth that are really, really deep. That's to help you grind food with your tongue, right? But in your stomach, you have the same ones, and they kind of push around and move it like this and smear it and get it all mixed with everything else it needs to be mixed with. Let's see. That's going to be, so it's going to be the stomach itself, right? Parotid, sublingual, and submandibular. An inflammation of one of these structures is called the mumps. Parotid. The way I remember this is like parrots have that spot here, like cockatiels. Parrots have a spot right here. That's parotid gland. There's sublingual and submandibular glands in there as well, salivary glands. And if you rub the little, there's like if you lift your tongue up, and you see there's a little pit right there. If you rub that with your tongue down like this, and then you can gleek, which is squirt some, you're stimulating that and squirting some saliva. Cool trick for his friends. Parotid, okay, that's those ones. Divisions include the cecum, the colon, and the anal canal. This is going to be the large intestine. Okay. And then the last one here, the organ that secretes the most potent digestive enzymes, glucagon, trypsin, and bicarbonate-rich secretion, that's going to be the pancreas. Look, I got 8 out of 8. There we go. That's less than 10 minutes. And just follow along with those things if you're having problems. I'm doing this because I'm checking through. Some people are having problems getting these things filled out. I'm going to do another section in a couple minutes. Talk to you guys later. See you later. Bye. Remember, this is week 5, assignment part 9.